Good morning, ladies and gentlemen. Greetings and warm welcome from Press Room of European Center for Disease Prevention and Control. My name is Andrea Horvat-Kramaric. I'm Head of Communication and Spokesperson and will be moderating. Tomorrow, the world marks World AIDS Day. For us at the ECDC, it's a good time to recap our work on the topic of HIV and AIDS for the EU-EEA area. With us for that purpose, we have Director of ECDC, Andrea Ammon. As always, we have also Anastasia, Pharris, Principal Expert for Infectious Diseases. And at the beginning, we will have short introductions by our two speakers, after which the floor will be open for your questions. Before we start, I would just like to say that when you ask a question, please raise a hand and introduce yourself or write the question in the chat. I would kindly also ask you to mute yourselves before speaking. And I would like to mention that our press conference is being web streamed. If we have no other housekeeping rules, I think you're quite familiar with those. I suggest we start, and I will give the floor to our director, Andrea Ammon. The floor is yours.
Yeah, good morning also from my side, and thank you for joining us for this press conference to mark World AIDS Day and also to the release of our joint report with the WHO Regional Office for Europe on HIV/AIDS surveillance. We present the 2021 data as well as the report on the continuum of care. Now, World AIDS Day is a global health day, and it was introduced by WHO already in 1988, so it has a long tradition. It is observed each year on the 1st of December and aims to raise awareness on the AIDS HIV pandemic. Since 2008, ECDC and the WHO Europe have coordinated the HIV/AIDS surveillance covering all 53 countries in the European region. And through our joint surveillance and the specific monitoring activities, we take stock where we are in the European region with meeting the Sustainable Development Goals, especially the one on health, which aims to eliminate AIDS as a public health threat by 2030. And that concretely means that by 2030, the number of new HIV infections should be reduced by 90%. Now, the surveillance data that we published today together with WHO indicates that the HIV programs in the countries have remained also in 2021 heavily affected by the COVID-19 pandemic. With about half of the EU-EEA countries reporting the same numbers or even a year-on-year progress in the numbers of people newly diagnosed with HIV in 2021 as compared to 2020. And this is worrying because as a whole, prior to the pandemic, most EU-EEA countries have been on the right track in reducing the number of new HIV diagnoses with a 40% decline over the last decade. There are places, however, in the EU and also in the wider European region where the situation is not improving. And this is why we encourage the countries to scale up their efforts to prevent new infections. Now, the groups that are disproportionately affected by HIV in the EU-EEA, that are men having sex with men, people who inject drugs, and some migrant population, still in this time experience high levels of HIV-related stigma and discrimination, which as a consequence, delays the diagnosis because they don't want to seek the proof of in the HIV test, and also don't stay sometimes in HIV care when they're diagnosed. Now, I mentioned the Sustainable Development Goal target on AIDS. There are other targets that were established in 2014 by UNAIDS, and they say that by 2020, of all people that live with HIV, 90% would be diagnosed, and of 90% would be on treatment, and of those on treatment, 90% would have a viral suppression. And that's known as the 90-90-90 targets. Now, for 2025, in order to reach the goal in 2030, these targets have been lifted to 95-95-95. And the models that UNAIDS has done show that by achieving these targets, the overall goal to eliminate AIDS as a public health threat by 2030 can be achieved. So where are we with this in the EU? The data that we show on the continuum of care, HIV care, show that the EU, EEA countries overall have achieved 2 of the 3 targets. And we basically missed the first one narrowly. So instead of 90% of all people living with AIDS being diagnosed, it's 88%. But of those that have been diagnosed, 93% are under treatment, and 91 of those on treatment have actually achieved a viral suppression. Now, that's the EU EEA average. As we see also in other situations, the progress of the single countries or between countries is uneven, some facing significant challenges. In the wider WHO region, especially in central and eastern part of the region, there are countries that are a long way from these targets. But we also have some good news. And one of them is that we have now an expanding list of prevention tools that we know that work. Programs that provide pre-exposure prophylaxis for HIV have led to large decreases in HIV incidence in places where these programs are accessible to the populations that need them. Also, harm reduction programs, including needle and syringe provision and drug treatment, have resulted in significant declines of HIV among people who inject drugs. Now, during the last decade, testing is also more and more available in more settings that include community and also self-testing, and a rapid linkage to after the positive diagnosis also to treatment. This effective treatment, the viral suppression, is good for the individuals, improves their quality of life, and it also eliminates the risk of HIV transmission to their sexual partners. Now, due to all these developments, we have observed a declining trend in reporting HIV diagnosis since 2012. Now, when we compare the number of new diagnoses with the estimated number of new infections over the last decade, it's evident that we are diagnosing more people each year than becoming newly effective. With HIV, and that indicates that the number of people living with undiagnosed HIV is decreasing. So what still needs to be done? Positive trends, there are still too many people, and that's more than half of those that have been mortality. We need to monitor trends closely to ensure that the setbacks that have been seen during the COVID pandemic have not made the situation on this late diagnosis worse, and that our surveillance and prevention programs work effectively. We need, of course, not only to diagnose what has happened, but to prevent HIV infection in those places and among those population groups where this has not already occurred, including the pre-exposure prophylaxis, harm reduction, more testing, early diagnosis, and a rapid linkage to HIV treatment. We have published a lot of guidance in the areas of HIV and also hepatitis testing, on pre-exposure prophylaxis, on preventing infections among men who have sex with men and people who inject drugs. So the guidance is available. There is, coming to a closure, also a need to better understand. Okay, so sorry for the microphones has. Okay, now I have two. That's good. So thank you. I repeat. There is a strong need to improve our understanding on HIV stigma and discrimination, and work towards, of course, reducing both of them within the affected communities and in healthcare settings. And many countries report that stigma and discrimination are factors that lead to or to the late diagnosis of HIV. So finally, the effective tools are available, and our goals for 2030 can be reached. We have, though, to put concerted actions in place and address major gaps that we still have in the prevention, testing, and treatment of HIV to get there. Business as usual will not do it. Thank you.
Thank you, Andrea. Now we go to Anastasia Pharris, our principal expert for infectious diseases. Anastasia, the floor is yours.
Thank you. Thanks a lot, Andrea, and good morning, everyone. I'd like to supplement Andrea's comments by providing a few additional technical details from the reports that we're publishing today. In 2021, 16,624 people were diagnosed with HIV in EU countries. These are among the more than 106,000 people diagnosed in the wider European region, and total about 45 people being diagnosed with HIV each day in the EU, and about 300 diagnosed with HIV each day in the wider European region. So as Andrea mentioned, this was a slight increase in the number diagnosed in 2021 as compared to 2020, but this is the first time in the last decade we've ever seen a year-on-year increase in the cases reported in the EU, and this is concerning. We know that there's some reporting delay that was caused by the COVID pandemic, and that we think that the 2021 cases actually would be further estimated up in future reporting cycles as countries start to catch up on their cases. As in previous years, in 2021, 3 times more men were diagnosed with HIV in the EU than women, and the largest proportion of those who were diagnosed are in the age group of 30 to 39 years. About more than half of new diagnoses are among men who have sex with men, and about 40% are due to heterosexual transmission, while only 5% are in the category of people who inject drugs. It's really important to have and to keep track of this information so that we can direct our prevention efforts to those populations that are most in need of enhanced prevention. We highlight late diagnosis as a persistent issue in the EU and also in the wider region. Late diagnosis of HIV affects about half of those who are newly diagnosed. And we know that this is associated with poorer outcomes for the individual. It results in higher healthcare costs and also results in unintended HIV transmission for those who are undiagnosed. It's likely that reduced testing and extra demands due to the COVID-19 pandemic on clinical sectors and also on public health institutes did impact case detection in 2020 and 2021, and we do believe that this is still continuing even today. A survey that we conducted as ECDC during the height of the pandemic indicated that at that time, 7 out of 10 countries in Europe indicated that they had reduced HIV prevention services, and 3 out of 4 countries in Europe had reduced testing in community and clinic settings. This may have resulted in delays in diagnosis and increased the number of people living with undiagnosed HIV. On the other hand, the decline observed in 2020 could be the result of some reduced transmission, and this is something we're looking at carefully. The physical distancing measures may have had an impact, but of a temporary impact on some reduced HIV transmission, but it's really too early to be completely sure about this. Overall, we've seen a 40% decline in the new HIV diagnoses in our region since 2012, despite this uptick we just recently observed in 2021. And the biggest success story and the biggest decline that we've seen has been in the population of men who have sex with men. All of the settings that have seen the biggest declines in this population have one thing in common, and it's that they have successful HIV testing programs. And so in settings that have these testing programs, they're seeing that those who are tested positive, they're very quickly linking those people to HIV treatment. And then those who are negative are being quickly linked to prevention programs, including pre-exposure prophylaxis or PrEP. Despite these good examples, though, we do see very uneven progress within the EU and in some populations within countries in the EU. And so that we know that there are some inequalities in terms of scaling up the right tools that we know work well to the right populations. We estimate that over 780,000 people are living with HIV in the EU, and that 88% of them are diagnosed. But that still means that 1 in 8 people living with HIV remain undiagnosed today, and they're not aware of their status. We do know that in the EU, most people who are diagnosed and linked to care live very happy and very long lives, healthy with HIV. But stigma in the community it does impact people, as does stigma in some healthcare settings, and this impacts quality of life and is an important issue. The reports published today by ECDC have key information on the epidemiology and on monitoring of HIV in our region. And based on the latest information we've collected, ECDC believes that countries should focus their efforts on addressing and closing the prevention gap. This would curb the flow of new infections, such as, and would also provide prevention that's needed to populations that are most in need, as we've mentioned, on pre-exposure prophylaxis and on harm reduction. The other major gap that our data point to is the testing gap, which we've mentioned several times. 1 in 8 people unaware of their status, 1 in 2 diagnosed late, means that much more effort can be put towards testing, making it more widely available, more routine for populations at risk of HIV acquisition in places that they can be found. So in the community, in healthcare settings, much more routine. So in sum, the picture that we bring you today is mixed. Declining HIV trends in some parts of the EU and in the EU overall over the last decade, but some increases more recently. The tools that we have, though, today bring unprecedented potential to impact the situation. We know it works, and so it's about applying this and ensuring that it exists at scale. At the same time, these trends that we've noted in the 2021 data do move in the wrong direction, and we do note many inequalities throughout our region. So how European HIV prevention testing and care services rebound to pre-pandemic levels will greatly affect countries' ability to reach the 2030 goals that Andrea mentioned, the Sustainable Development Targets on health, and our collective ability to eliminate HIV as a public health threat. Thank you very much.
Thank you, Anastasia. Ladies and gentlemen, with this, I open now floor for your questions. So please, if you have any, kindly ask our dear speakers. If you want to, if you know who would you like you to give answers to your questions, please also indicate that. Okay, so Sarah from Politico, please, the floor is yours.
Hello, Sarah Tacey-Benchery from Politico Europe in Brussels. I just have a question about the year-on increase in HIV diagnoses between 2021 as compared to 2020. Since we're doing year-on-year comparisons, I was wondering, and you also mentioned that in 2020 there was a decline that may or may not be associated with, reduced social contacts due to the pandemic, but we don't know for sure yet. Is the 2021 value how different it is from like 2019 value before the coronavirus pandemic? Like, are we back to baseline, or is it just increase relative to a relative decrease? Sorry, I don't know if that makes sense, but I think I see you nodding, so maybe yes. Thank you.
Yes, it does make sense. Yeah, this is important. And one way we've looked at this is actually by looking at 2019 compared to 2021 and sort of not ignoring, but not really drawing the line through the 2020 data, because it is quite heavily impacted by COVID. And there we do see a decline, so of about 24% from 2019 to 2020. So that is good news. But we also know that in the most recent year, there often is a bit of underreporting as countries filter the cases up through the system and validate them and deduplicate them. And so usually we try to correct for this with some statistical methods, but nonetheless, usually by the following year, countries tend to report a few more cases. So we're looking at this carefully. We did not see an impact with regard to late diagnosis, for example, getting much worse over time. So that was good. And that's also something we're looking at carefully and discussing with European countries.
Thank you.
Thank you, Sarah, for the question. Thank you, Anastasia, for the answer. Do we have any further questions? Okay, we have Anne. Please, Anne, the floor is yours.
Hi, thank you very much. It's Anne from the Netherlands, from the Algemeen Nederlands Persbureau. I was wondering, I read through the report and also the press release, and I thought the tone was much more negative than what you just presented to us. So I was wondering, I read, for example, in the press release said much more the link between the impact of COVID on testing facilities, linked to the fact that there are less diagnoses in 2021 than in 2019. So I was wondering, how should I read that? Is that because now I hear you say it's a quarter less compared to 2019, and it's a good thing. Whereas when I read the report and the press release, I read it much more as a negative or a concerning thing. So can you maybe go into that a little bit more? Thank you very much.
Thank you. Andrea will provide an answer for you.
Yeah, I start and then I hand over to Anastasia. Now, as Anastasia has said, it is a mixed picture. And it's also, for us, not entirely clear yet how to interpret what we are seeing, as far as it is impacted by the pandemic still also last year. So I think that is what we try to balance here. We recognize that countries have done efforts, quite a lot of efforts, despite having the whole pandemic activities also on their plate. So for us, really, we have to look at this in a more medium, long term, well, medium term, maybe not long term, perspective, to see what it really means, and also to interact with countries to see where they place it themselves, what has happened. Anastasia.
Yeah. Just to add on to that, one of the challenges with HIV is that often when people are initially infected, they have no symptoms. And so they can live for quite a few years unless they're tested routinely without having developing symptoms until the immune system starts to fail much later on. That can take up to 8 to 10 years. And so we have done some analysis, and this was prior to the pandemic, that on average between infection and diagnosis, it was about 3 years for on average in the EU. So that means that some of the cases we're detecting today were infected prior to the pandemic. And we actually still have this black box where we know that services were impacted in 2020 and 2021, and some have not rebounded, both prevention services and testing services. So the effect that this has on the future cases, which are not yet diagnosed, is a bit of a question still. And this is something that we are keeping close attention toward. And what we can do is monitor the prevention programs. And this is what we are doing at ECDC together with colleagues at WHO to really ensure that prevention is rebounding and that the things that we know work best are being provided to the populations that we know need them. But we know where this will go for 2022, 23, 24 remains to be seen.
Thank you.
Thank you, Anne. Thank you, Andrea and Anastasia. We go now to Mose Appelblatt from the Brussels Times. So Mose, please ask a question. Unfortunately, we cannot hear you. If there's
Now, do you hear me?
Yes,
Okay, I'm sorry. Well, you said that the picture is mixed and also uneven by a member state. So I would like to ask you if you would like to highlight the member states which have been successful in his anti-HIV programs, diagnosis and prevention programs. Thank you.
Yeah, I think you, when you take the report on the continuum of care, I think those countries that are doing fairly well, and those that are sort of in close vicinity to the target, and those that are not reaching the target are clearly marked with colors. So I think there you see already get already an impression which countries are doing fine and which other countries still have to make additional efforts. Anastasia.
Indeed. And the HIV incidence, is quite uneven across countries. And as we mentioned, it affects some populations more than others within countries. And so what's quite important and what we highlighted in the Continuum of Care report is that we look overall what proportion of people are being diagnosed and then put on treatment and virally suppressed. And this is really, really important. And countries in the EU, nearly all countries are able to provide at least most of the data on those indicators as a whole. But we need to drill down and have better data on the key populations that are most affected. So how are populations of men who have sex with men, what proportion are diagnosed, put on treatment and linked to care and have successful viral suppression? What about people who inject drugs and other marginalized groups in countries? And so this is where we're working together with the countries to try to support to have really this more and also on key populations going forward so that it can be very clear where we're not meeting those targets.
Thank you.
Thank you, Mose, for the question. We go back to Sarah from Politico. Sarah, please go ahead.
Hello, sorry for the second question. In the WHO Europe press release, they have a line that I was wondering if you could clarify or reword in a way that might be a bit clearer to me. It says, in contrast, in the EU EEA, there were slightly more diagnoses than HIV infections during the last decade, indicating that the number of people living with undiagnosed HIV is likely decreasing in many of those countries. My question is, what's based on actual numbers versus estimates? Because I had a bit of a hard time wrapping my mind around how there could be more diagnoses than HIV infections, essentially. Yeah.
Okay.
I think I understand it, but I just want to be really clear on it. Thank you.
Absolutely. Thank you for the question. So the diagnoses are drawn from our report for the full region and for the EU, and those are based on cases that are diagnosed and reported through laboratories and through clinicians, and then come up through the surveillance system. The estimated infections are based on a modeling exercise, and there are a lot of uncertainties. We tried to put a band of uncertainty in the figure in the report around that. And so this is, trying to really do a little bit of that projection of who are the cases who maybe have been infected but not yet diagnosed. And COVID does make this exercise more challenging. We believe it's reliable data, the most reliable that we have. And then we want to look at the relationship between what is how many are we diagnosing and how many are being infected. If we're diagnosing more than are being infected, we're reducing the undiagnosed proportion. We're reducing the number of people living with undiagnosed HIV, and that is a good thing. And we have a slight difference in the EU, where we are diagnosing more people that are being infected. In the wider WHO European region, the opposite is true. And so more people are becoming infected, we estimate, than are actually being diagnosed. So we're actually falling behind as a wider region. And of course, country by country, this varies, and one can look at that data specifically.
So is it fair to reword this as they're based on the estimates of infection rates that the modeling tells us there should be based on current patterns and data, we are detecting a greater proportion of the estimated infections out there than before?
Yes, over time in the EU, but
Perfect.
not in the European region.
Perfect, thank you.
Thank you. I hope this is a good clarification. Do we have any other questions? So far, I see nothing in the chat as well. So last chance to ask question. Okay. Well, if there are no more questions, I would like to thank you for participation, for following our work. If you have any questions whatsoever, please write to us in our press mailbox. And until further opportunity, we wish you all the best and stay healthy.
Thank you.
Thanks.
Thank you.